it's not just colleagues who raise questions. I mean, patients have questions. My mother, when I first started doing telemedicine, was like, how does that work? That doesn't make any sense. Um, the main way is you teach patients how to examine themselves.
Mm.
And there are definitely things that patients can do on their own. So, just as an example, carpal tunnel syndrome, a relatively common occupational medicine complaint. One thing that can be used to assess and diagnose carpal tunnel syndrome is to look for a Tinel sign. Tinel sign, if they were in my office, I would bend their wrist back slightly and then tap right here for about 30 to 40 seconds. That's what I would do to the patient if they were in my clinic. Well, there's no reason that a patient can't do that themselves. I do the same thing. I say, okay, what I want you to do is bend your wrist back a little bit, take your index finger, and I want you to tap right here for about 30 seconds. I'll let you know when to stop. And if they're tapping down here, I say, no, okay, come on, go. Oh, right. Yeah, that's the spot. Tap right there. If they're tapping like, no, not just press. I need you to tap a little bit. If they're pounding on their wrist, it's calm it down a little bit. So you work with the patient and you correct them in their techniques, and eventually they're able to do what I would be doing in an office, but they're doing it on their own. Similarly, let's just say I have a shoulder injury. If someone had a shoulder injury, they came into my office, I would start by just kind of for just palpating, pushing around the shoulder, looking for a tender spot. So this comes up a lot where I ask patients to push on things. I say, is there anywhere that hurts the touch? If you're pushing on things that hurt the touch, and they're like, no, not really. I'm like, okay, if you were in my office, I would actually literally push and say, does this hurt? Does this hurt? Does this hurt? Does this hurt? And look for where those spots actually hurt. So since I can't do that, I need you to do that for me. And so really, I want you to push and let me know, are there any spots in that area that if I was doing that, you'd say, ow, that hurts. I can have patients do range of motion. I can, again, shoulder injury. I can have them, if they were in my office, I would move their arm myself. Well, again, just have them do it. Have you move your arm forward, back, rotate it. So I can pick up a lot, everything, no, but a lot of the things that I would get by examining someone in person, I can get that through a virtual exam using the patient to examine themselves. Um, if they had a family member or a friend present, you can always use them also. You can have that person, again, teach that person what you want to do. Watch what they're doing, correct their technique if it's off, and you can get all the stuff that I'd be getting if I was seen in person. Now, the other thing, though, is to acknowledge there are limitations. I can't do everything. I mean, telemedicine is appropriate for many things. There are many things that I can diagnose and treat and feel very confident doing, but I can't do everything. And so I think it's important to acknowledge to the patient or my colleagues if they ask questions. Um, yeah, there are some things that I'm not going to be able to do. If a patient hits a plateau where they're not improving, if during the exam that I've witnessed, if there's something that doesn't quite fit, doesn't quite make sense, or if I want some extra piece of information that I can't get just by having them examine themselves, well, I need to say, hey, I think this is probably fine, but I'm not entirely sure. I think in this situation, it's better that I get you seen in person just so we can get a more detailed exam just to make sure that I'm not missing something. So again, teach the patients, teach a family member, but again, make sure that the patient says, understands that I don't think I can do everything. I'm not just like, oh, telemedicine's fine, just do everything this way. No, acknowledge that there's limitations and tell patients that if they have any concerns about their progress, or if I have any concerns about their progress, I always have that opportunity to get them seen in person for a more detailed exam.